talk on my favorite topic, and two topics are favorite to me. Cervical Cancer Mukt Bharat, and today I'm going to talk on the science of HPV and HPV vaccination. Presentation of today and the presentation of the 16th are going to make a complete knowledge as far as HPV vaccination is concerned. And the people who attend onto this, I will send a Google this thing, and then so whoever names are there, they'll be given an e-certificate for the same. I think it's a complete knowledge. We all know that HPV infection and cervical cancers in India are a huge number. And there are 48 crores people for more than 15 years who are at risk of cervical cancer. And as you all know, that 200 women die per day. And every 8 minutes, a woman is dying of the cervical cancer. So that's a huge tragedy. And it's my request that all of you say no to cervical cancer. This is my request from Delhi Gynaecologist Forum and North India Gynaecologist Forum. When we speak collectively, it has a laser effect. Unimaginable effect when we speak collectively, cervical cancer Mukt Bharat. HPV-related cervical cancer can strike at any period of woman's life. And you can see that some real-world celebrities are former Miss World contestant Sherika Diamas died of cervical cancer at the age of 26 after battling for cervical cancer for 2 years. She was just 26. Another television personality, very famous personality from UK, Jade Goody, also died at the age of 28 for struggling with cervical cancer. And then you can see on the extreme right, Janet Howard. She had been wife of former Prime Minister of Australia, who has longest spell as a Prime Minister. His wife had cervical cancer. He publicly came and spoke about it. If my wife can have it, that what will happen to the rest of the Australian people? And she's a cancer survivor, and she did a tremendous work. And now Australia stands tallest as far as cervical cancer elimination thing is concerned. We all know about the WHO has already given a clarion call of 90-70-90, which was on 17th of November 2021. And as I said, today the focus will be on the science of HPV and the HPV vaccination. As you can see in this particular graph, there are 660 million women who live with HPV positive. As far as India is concerned, we see 6 to 7% of her cases are HPV positive. Only yesterday I was listening in Indo-Egyptian adolescent health workshop. They said that the HPV incidence in Egypt is around 12%. And they take a good number of people. There are 30 million are genital warts. Cervical cancer, you can find that high-grade lesions are 10 million. Out of this, cervical cancers are 6 lakhs. Low-grade dysplasias are 30 million. One can see that HPV causes much more than just cancers. HPV-related diseases and cancer, one death is happening every 5 minutes. And when it comes to HPV cancers, we only think of cancer cervix. But there are many which you can see on the screen. HPV is necessary cause of cervical cancer and other cancerous lesion around anogenital region and oral mucosa, besides anogenital warts and respiratory papillomatosis. This slide is $1 million slide for each one of you. This shows that as far as India is concerned, HPV infection is seen in 6.6% of cases. These are the statistics of 2021. The overall genital warts prevalence in India estimated at 1% and was higher among men than in women. At any given time, about 6.6% women in general population are estimated to harbor cervical HPV infection. Age-related prevalence of CIN1 and CIN2 was 2.3 and 0.5% respectively. The age-adjusted prevalence of CIN3 was 0.4%. And as far as the cervical cancer load is concerned, it is 1/5 of the global cervical cancer load. Anything specific you want to know about various cancers, again, the Indian incidents are right here, given by the government of India. One can see that India's contribution is 1/5 to the global kitty of the cervical cancer burden. And we all know, because cervical cancer persons come late, there's a 50% fatality rate. HPV infection can occur throughout woman's life, from menarche to menopause, as has been shown in this particular slide. You can take any age group from 15 to 45 years. The graph is going up and up and up. So the women remain at risk for acquiring HPV infections throughout their life. And as you can see here, the cervical cancer strikes at the productive period of woman's life, and the median age is of 38 years. It is said that cervical cancer occurs a decade earlier as far as Indian women are concerned. Almost 24 average years of life is lost in a woman with cervical cancer. 24 years of life is lost. And India stands at 18 per lakh as far as the cervical cancer incidence is concerned. Earlier the sexual debut, the risk of HPV infection-related cancers increases tremendously. In India, the average median age at the first sexual intercourse among women is reported to be 19 years, with the range between 25 to 49 years. It is said that people who are engaged in sexual activity at a younger age, it has been linked approximately twice the risk of developing HPV-related cancers and diseases in the future. The risk of HPV infection for women with a single partners. There is a myth among them that we do not require any vaccination or screening. The facts are that 1 out of 2 women are at risk of getting HPV even with single partner. 30% at the end of 3 years and 50% at the age at 5 years past marriage. Pregnant and postpartum women are more susceptible to HPV infection. And this is attributed to younger age at first delivery, injuries to the cervix during vaginal delivery, thinning of the cervical epithelium, cervical ectropion, and multiple vaginal deliveries subsequently, which bring about, besides changes in the hormonal milieu, decrease in immunity. And these are some figures which you will be finding it for the first time. Many cervical abnormalities are detected during postpartum period. 1 to 3% women diagnosed with cervical cancer are pregnant or postpartum at the time of diagnosis. About half of these cases are diagnosed antenatally, and other half around 12 months postpartum. So 1 to 2% incidence of abnormal cervical cytology finding are there during pregnancy. 45 to 50% of pregnant women are at risk of high risk for HPV infection, and around 30% women of postpartum women are at high risk for HPV infection. On an average, I just now told you that the sexual activity report have been approximately in the woman's lifetime, the sexual partners are 1.7 as far as India is concerned. Only 0.04% of the women are exposed to all 4 prevalent serotypes of HPV available in quadrivalent vaccine, and over 99% can benefit from the HPV infection if taken, because the 4 viruses infected them is only 0.4%. Now coming to the prevention of cervical cancer. This is the pyramid given by the WHO of the prevention of cervical cancer control. You can see the vaccination makes the broad base. The secondary prevention is screening and the treatment of cancers, and the tertiary prevention is cancer treatment. As you can see, this particular study, you should be proud. It has been done by ICMR, very often quoted in international arena whenever there is a talk of vaccination. According to this, if one can give a vaccination alone in any population, 44% cervical cancer load in that community will come down. So roughly it is 50% load can come down if you just vaccinate the population alone. And if this particular woman is screened by any of these methods, once or twice or thrice, it has been found when it is vaccination plus screening 3 times, it can decrease the cervical cancer load in any community by 65%. This another slide is again a $1 million slide, which shows that HPV vaccine stands tallest. This has been given by WHO again, 2020 Cancer Bulletin of WHO says, if you give 1,000 vaccination of HPV, you save 20 lives. No other vaccine comes near to HPV vaccination. The next one is hepatitis B, where you give 1,000 vaccination and you save 10 lives. So this must be remembered by each one of you. You all know the success story of the West in the cervical cancer prevention by screening. The incidence of HPV infection in the community has been brought down by 70%, and deaths due to cervical cancer has been brought down by 80%. And you all know this particular graph of WHO giving call of 90, 70, 90. As far as Indian scenario is concerned, we stand at dismal in comparison to the Western world. Our vaccination rate is 0.1%. Our screening rate is 3%, again given by the government of India. And only 10% gynecologists are trained in treating precancerous lesions. As for the Western scenario is concerned, you can find that improvement is there in vaccination rate from 50 to 90%, in the screening rate again from 50 to 90%, and as for the treatment part of the gynecologist is concerned, is again 80 to 90%. And the WHO expects that the Western world by 2030, many countries will be declared cervical cancer free. And you like to know which is the country which is going to be declared first. The Spain number is the highest, and then probably Australia, and then many European countries will follow. And by 2030, many countries will be declared cervical cancer free. If they can do it, we can also do it. But you must remember our dismal performance, which I have just now shown in this particular slide. The Western world and the WHO think tank feels that with comprehensive approach to prevent, screen and treat, cervical cancer can be eliminated as a public health problem within a generation. Otherwise, it was said earlier that if India starts thinking of cervical cancer elimination, it will take 100 years. But I think the picture can be changed tremendously within a generation alone. So this particular figure of WHO call, you all know of the cervical cancer prevention. Now here I just wish to remind you, Sarvapalli Radhakrishnan, who had been the vice president of this particular country, he visited Lady Hardinge Medical College during a Golden Jubilee celebration, and he said that the greatest tip to the public health worker is you give your 100% service for 10 years in the schools and see the magical effect. And so will happen once you give adolescent HPV vaccination during adolescent time and see what will happen 10 years down the line. So let's make India cervical cancer Mukt Bharat. Coming to HPV vaccination now in particular. As I talked to you in 2024, majority are unvaccinated, 99.9%, unscreened 97%. And also, I just wish to remind you of all the cancers in a man and a woman. Cervical cancer is the only cancer which is 100% preventable. Government and the specialists of this country are on the same page as far as cervical cancer Mukt Bharat is concerned. Everybody wants the same. To eliminate cervical cancer, Government of India has got implementation effective strategy, and out of this they have already committed for adolescent health vaccination. As for the screening and the treatment part is concerned, it is all up to specialists. So adolescent HPV vaccination given between 9 to 14 years by the Government of India is a big hope which will make a big base to eliminate cervical cancer. HPV vaccination to adolescent girls by Government of India is committed, but this only amounts to 30% of women will be vaccinated against HPV. What about remaining 70% women above the age of 14 years? This is where the role of we gynecologists, pediatricians, medical officers, nurses in the private sector matter to make the cervical cancer Mukt Bharat, to help the Government of India achieve 2030 UN Sustainable Development Goals. As you can see in this particular chart, that Gardasil and Cervarix was approved in 2006 by US FDA. Gardasil came and Cervarix came in India in 2008, and till date they have completed 17 years. Gardasil 9 was introduced in 2021 and Cervarix was introduced in 2023. The WHO approved of 2-dose HPV vaccination for adolescents in year 2016. We all know that our indigenous HPV vaccine, which is a world-class vaccine, Cervarix, is available in our country since 8th of March this year. Both Cervarix and Gardasil 4 are quadrivalent vaccines, have an HPV 16, 18, 6 and 11. And you know, for elimination of genital warts, you require HPV 6 and HPV 11, which can eliminate almost 100% cases of genital warts. So if you give bivalent vaccines, these warts will not be taken care. And you all know that the 16 is the biggest culprit and then follows the 18, and together they form 83% of the cervical cancers in India are totally because of 16 and 18. Now this is the chart of vaccination schedule which are available. We have Gardasil 4, which is permitted from 9 to 45 years. To the girls of 9 to 14 years, there are 2 doses at 0 and 6 months. Women who are more than 15 years till 45 years, there are 3 doses, 0, 2, and 6 months. Gardasil 9, for boys it is 9 to 15 years, 3 doses. But as for the girls are concerned, 9 to 14 years, there are 2 doses, 0 and 6 months. And as far as 15 to 26 years is concerned, there are 3 doses, 0, 2, and 6 months. Cervavac, as you know, is a gender neutral vaccine, just like Gardasil 9, which is available in our country. Girls and boys between 9 to 14 years, there are 2 doses, 0 and 6 months. And young girls and men from 15 to 26 years, again, there are 3 doses, 0, 2, and 6 months. All HPV vaccines are stored at 2 to 8 degrees centigrade, not frozen, but protected from light, and 0.5 ml dose is given intramuscularly in deltoid region, and the persons must wait for 20 minutes after vaccination in the clinic. And my advice to the private sector doctor is it is good to give injections themselves. Now coming to the SAGE recommendation. As you all know about the SAGE recommendations are that from 9 to 20 years, you can give single vaccine and it is effective. So it is a choice of the government whether they want to use 1 dose or 2 doses. It is absolutely up to the government and the experts of the government. Till now, it is off-label because DCGI has to make an approval. Then only all the gynecologists and the pediatricians in the country can use a single dose once the policy has been taken by the DCGI and the government of India. As far as the boys are concerned, the boys can be vaccinated from 9 to 26 years with Cervavac, 9 to 14 years, 2 doses, and 15 to 26 years, it is 3 doses. Gardasil 9, I just wish to repeat you that as for the boys are concerned, 9 to 15 years, there are 3 doses, 0, 2, and 6. So level of recommendations are given on the right-hand side. Now, what about HIV positive cases? 3 doses, again, there is no promise for protection as per guidelines, and screening has to be done on a yearly basis. Optimal dose is the dose I have just now told you. The vaccines which are available are Gardasil 4, Gardasil 9, and Cervavac. The primary focus of anywhere all over the globe is WHO recommends the primary target population for cervical cancer elimination is for HPV vaccination is the girls of 9 to 14 years before they become sexually active. And by achieving 80% coverage of girls, it can reduce the risk of HPV infection for boys as well. Many countries, including Australia, have shown this particular results. As for the secondary target group is the boys aged between 9 to 26 years, older males or men who have sex with men. The vaccine is recommended only if this is feasible and affordable and does not divert resources from the vaccination of the primary target population, that is adolescent girls. What about the co-administration of HPV vaccine with other vaccine? As per licensing indication, specific HPV vaccine may be administered concomitantly with other vaccine, that is flu, etc., with no clinically relevant interference with antibody response to any of the components of either vaccine. But if you want to give 2 days later, it is not permitted. Then the gap has to be 15 days. Either you give on the same day or the gap has to be 15 days. Now, specific situations. It is not recommended for use in pregnancy, but if the patient conceives after the first dose, it is advisable to give further doses after pregnancy is over. If inadvertent vaccination during pregnancy and no need for medical termination of pregnancy in case if the pregnancy occurs. Lactating women can receive HPV vaccine. Available evidence does not indicate an increased risk of adverse events in either to the mother or the offspring after the administration of HPV vaccine to lactating women. Now, if there's a sexual assault takes place, the sexual assault survivor should be given age-appropriate HPV vaccination with the first dose at the time of initial examination. The woman with abnormal PAP, the positive HPV test, previous HPV lesion can be vaccinated if they desire. However, they are counseled that it is not therapeutic vaccine and will not treat existing virus and the pathology, and there is reduced efficacy in older women. HPV is a primary prevention intervention and does not eliminate the need for screening, since the existing vaccine do not protect against all high-risk HPV oncogenic viruses, which are almost 50. The screening of the cervical cancer should be done as per guidelines. The question comes, do both HPV vaccine, quadrivalent and nanovalent, offer the same protection against the HPV infection? दूध में जितनी शक्कर डालोगी उतना ही मीठा होगा. So nanovalent vaccine has got 9 HPV virus, 6, 11, 16, 18, 31, 33, 45, 52, and 52. The quadrivalent vaccine efficacy and the bivalent vaccine efficacy is 98%, and this has an edge and has a wider spectrum. Coming to the HPV vaccination in postpartum period. We all know that the awareness about HPV and its vaccination among the pregnant women is very low in India, as you can see in this particular slide. So there is an urgent need for addressing the knowledge gap for increasing community awareness towards cervical cancer prevention through HPV vaccination during the lactation time. So 90% of patients who can be vaccinated by you. The prenatal period and the postpartum period provide an excellent opportunity for cervical cancer counseling and vaccination. As you can see in this particular slide, higher the number of a normal pap smear results in postpartum HPV vaccinated woman compared to the unvaccinated woman, showing that significant difference in postpartum pap smear results were observed between the vaccinated and unvaccinated woman. Higher percentage of a normal pap smear results were observed in postpartum HPV vaccinated woman compared to the unvaccinated woman. Available evidence does not indicate an increased risk of adverse events linked to the vaccine in either mother or their babies after the administration of HPV vaccine in lactating females. HPV vaccine is effective and well tolerated in lactating women, and the rates of adverse experiences in the mother and the nursing infants were comparable between the vaccination groups. You can see the FOXC, American College, WHO, and US CDC all recommend HPV vaccination for breastfeeding women. Which HPV vaccine after childbirth? You can see the quadrivalent vaccine is recommended through 9 to 45 years, and the nanovalent vaccine is recommended in girls and women up to 9 to 26 years. So depending upon the age, both vaccines can be used. Bivalent never did any study on breastfeeding mothers, and the Sarvavac also has not done any study on breastfeeding mothers. And they have not also requested from the DCGI as far as vaccinating this group is concerned. Is HPV beneficial after childbirth? I've already given you enough data, and all of you should be enthusiastic to use HPV vaccine in postpartum women. Almost you can make it to 90 to 100%. Now, what is recommendation dosage of HPV vaccination after childbirth? I just now told you up to 26 years, you can use both quadrivalent vaccine and nanovalent vaccine, and up to 26 years, you can, after 26 years, you can only use quadrivalent vaccine, which is Gardasil 4, available in our country. Is HPV vaccine effective in sexually active women? There's a myth in people, especially in gynecologists' mind, that sexually active women, it is not effective. It is said the study has been done by Gardasil 4 they have demonstrated that only 0.4% of the women are exposed to 4 prevalent HPV serotypes, and thus 99.6% of the sexually active women may benefit from the vaccine. As shown very clearly, there were 2 groups taken. One was 9 to 26 years, where 99.9% vaccine was effective, and another group was from 26 to 46 years, where it was effective to the tune of 99.6%. Can HPV vaccine cause infertility issues in the future? There is no evidence available to suggest that HPV vaccine has an effect on the future fertility. There is no link with miscarriage, premature labor, or other types of pregnancy complications. Do any national or international medical organization recommend HPV vaccination in postpartum women? I already showed you that particular slide, that all bodies recommend in postpartum women. When coming to the vaccine safety for all types, there is no serious safety issue to date. Rare report of anaphylaxis. The Global Advisory Committee for Vaccine Safety has not identified any safety concerns. HPV vaccines are safe and well tolerated and can be used in persons who are immunocompromised or human immunodeficiency virus infected. Adverse events following HPV vaccinations is generally mild and of short duration. We do not have any long follow-up data as the Cervavac is concerned. So whatever I'm going to now further talk is about the Gardasil 4 and Gardasil 9. You can see the safety profile of quadrivalent and the nanovalent HPV vaccination is demonstrated by over 20 years of clinical development and the real-world evidence. There had been males from 9 to 26 years and the females from 9 to 45 years had been enrolled in pivotal clinical trials in 27 countries. More common adverse effects were there for the injection site and minimum headache, and they were of mild to moderate intensity only. You can see here, as far as the nanovalent vaccine is concerned, females from 9 to 15 years, it was gentle warts or high-grade intraepithelial. There was zero breakthrough, 100% effective, and 10 years data is available. As far as the females between 16 to 26 years are concerned, again, zero breakthrough as far as CIN3, cervical, vulvar, and vaginal cancers are concerned. Again, no breakthrough. 10 years data is available. Robust clinical programs of quadrivalent and nanovalent provide long-term follow-up data through 14 years, as you can see very well in these slides. And in the small letters, it has been written that 14 years, no breakthrough has been found in HPV-related CIN2, carcinoma in situ, and cervical cancer. So in everything category, everything is given, how much and for what the data is available. And you can see in the efficacy and immunogenicity trials of quadrivalent vaccine, it is there all in public domain, Future 1, Future 2, and Future 3, showing the efficacy of this particular vaccine to the tune of 98%. Efficacy and the immunogenicity of a nanovalent vaccine, you can see these are the 9 viruses which are there in this particular vaccine, and this is definitely more efficacious, though at this particular time it's costly. Once the cost factor will go away, probably this will have an edge over quadrivalent vaccine. As for the quadrivalent vaccine is concerned, it has demonstrated long-term effectiveness, immunogenicity. Again, it is 100% effective. 14 years data is there that there has been zero breakthrough as for the high-grade cervical lesions and the cancers are concerned. You can see, I think all of you are aware about these kind of effectiveness, but the data is right in front of you. There's a high, when it comes to catch-up vaccination, the people who have not been given vaccination during adolescent time, there's a high efficacy, immunogenicity, and acceptable safety of quadrivalent vaccine in a woman between 24 to 45 years is known. The administration of HPV vaccine is associated with high degree of patient satisfaction in postpartum patients to the tune of almost 90%. Tolerability profile of HPV vaccine in adult woman is it is generally well tolerated in adult women. So in summary, the HPV is the most commonly sexually transmitted infection, persistent infection which can lead to development of anogenital warts, precancers, cervical cancers, and other anogenital cancers in women. Postpartum women are more susceptible to HPV infection due to changed hormonal milieu and decreased immunity. India contributes to 1/5 of the global cervical cancer burden. Combining cervical cancer screening with the vaccination can reduce cervical cancer risk of 63% as far as ISMR study is concerned. The majority of the women in India visit the gynecologist during pregnancy, making it good opportunity for the cervical cancer counseling and vaccination during the postpartum period. The HPV vaccine has demonstrated effectiveness with good tolerability profile in adult women. Various guidelines recommend HPV vaccination in postpartum period in lactating women. So, say no to cervical cancer. You gynecologists can make a big difference, and the whole medical fraternity also can make big difference. I'm the ambassador of this 90-70-90 program. I request that you also become the ambassador and join this particular movement. Thank you very much.